Good evening. How's everybody doing?
Good evening.
We have about 4 minutes left. Are you all coming from another class?
Yes.
Okay.
Dr. Morton, can you tell me if I'm supposed to be in this class? Because they moved me out of this class. I had to do everything all over again. They gave me a professor that says she don't even teach anymore. I've been trying to log onto her Zoom for like 10 minutes. And then I finally just called her phone and she says she don't even teach anymore. So I don't even know if I'm supposed to be in here because they took me out and I lost all my work and everything. And then now I'm confused.
Yes. A class closed, several classes closed. Yes, it was kind of, let me look and see. And what is your name?
Patrice Hill.
Let's see if I see your name. Yes, your name is on the roster. So you are in the correct class.
So I wonder why they made me lose all my work.
Yes, and that happened. So we were allowing everybody to just go ahead and just resubmit it. And yes, because your work is actually inside of another class, the one that they close. And so once it closed, it's just kind of closed with that. But no fear, you are here. And so, just submit your work and, do email communication, stating, hey, I was in another class, that class closed or was canceled. And I would like to submit my work. I know it's frustrating.
Dr.
Yes.
Did you ask about Black Friday?
I did not. And you didn't email me, text, or anything to say, hey, did you find out about it? No. Let me put this right. Wait a minute. I have a list here. I did not. I can actually send on.
If it helps any, Dr. Morton, we were told that we do not have class, but I wanted to verify that with you.
Okay. I do not know, and I did not ask, but I'm looking for our numbers here. Okay. We have 1 minute before we actually get started. So if you would, good evening to everyone. Go ahead and be placing your name and your campus in the chat. I should have an answer before we close tonight. So good evening again. How is everyone doing tonight?
Wonderful.
Great.
We're doing pretty good.
Good. It is Friday.
Yes, it is. Happy Friday.
I know. So go ahead and place your name in the chat and your campus. Turn your cameras on. Just as a reminder, these sessions are recorded and they are and just go ahead and put this stuff on mute. I'm hearing an echo. And so just a reminder, these sessions are recorded and they are placed so that, your deans and everyone can have access to them. So just we just want to make sure we're doing what we're supposed to be doing because that's what we're supposed to do anyways, not because someone else is going to view this, but because that's what we're supposed to be doing. So we will go ahead and get started. Just as a reminder too, these sessions are recorded and we push the recordings out so that you can review them at a later date, because that helps, reinforce the information that the concepts and things that you were not so sure about. So that's made available to you also. Now, the orientation class meeting. Do I need to send that link out too, or do y'all need that orientation class again? Recording, do I need to send that out? Or we're good on orientation information? Okay, but going forward, the class, we actually go with most of the content, we'll actually send those out. We'll convert them to YouTube and we'll send the link. All right, so, and I will remind you again, hopefully at the end, if I do not forget to place your name and your campus in the chat, because that shows, that's part of your attendance. So again, welcome to some of you all. Some of you all were not in this class on last week. Some classes were canceled, and so you got moved around. And so no fear if you were not able to turn in your assignments. Please communicate as we have, and as the professors are saying in all of your courses, place an email, do a text message, preferably email, to communicate whatever the issue is that is causing you not to turn in work on time. And I'm still hearing someone. Please mute. Let's see here. Just make sure everybody's on mute. Okay, let's go ahead and get started. So our order of business, we will go over our notes from week 1 and week 2. We would do our attestation tonight. We'll go over that. We'll go over our quiz. So hopefully you have not, because I told you on last week, do not complete your quiz. That will be one of the activities that we'll do in class for each quiz. So just hold off on that. So we'll work on that together. And then if we have a chance, you'll complete your 2 peer responses if you have not already done that. So that's our agenda for tonight. So we will go ahead and get started. Let me just see. Let's do some quick announcements. Told you about the communications. If you're unable to complete any task or assignments, please communicate that, preferably in an email, with the reason and what assignment that you're having trouble completing. Please do that prior to the due date. So we are working on the exam 1 study guide. We should have that out by Sunday, no later than Monday, because exam 1 is in 2 weeks. So we will have that out. So just narrowing down the content for you. The schedule is already out for the live review sessions for the exam reviews. You might want to look at the schedule, just plugging you some dates. Of course, the recording links will be provided for you so that you can look at those at a later time, but just make sure that you try to attend those live sessions so that you can actually ask your question and clear up whatever things that you need to clear up. And they're not mandatory. The list and you can attend one of the other professors. You can attend all of them. There will be a total of 3. So just go ahead and pre-plan that, plug those dates on your calendar. The HESI prep assignment, we should be able to start working on that. It's not due until I think week 9, but the plan is to try to work on it along the way as we cover topics for you all to go in and, and complete the parts. And so by week 9, you can just go back and put your finishing touches and then be able to submit it rather than starting on it, a couple of weeks before. So hopefully we'll be able to start working on that next week. And for your NCLEXs, remember you can try as many times as you like, hopefully trying to get the total points, those 50 points for those 50 questions. Look at those rationales because they help you with the understanding of why the correct answer is the correct answer and why the incorrect answer is the incorrect answer. So make sure you look at those rationales and just keep, doing it. Take it as many times as you can to get the highest score. Because most of the time, not most of the time, it does. Every point does count. So you want to do that. Okay, so let's move forward. No, week 7 group project paper is about infectious disease. We probably will look at that next week, assigning your groups and assigning your infectious disease topic. The plan is to give you all time in class to actually get together in that group to talk about, do introductions and talk about what your plan is and decide who's going to actually do what. And week 9, your vulnerable population PowerPoint is due. We'll try to incorporate some of those things and activities during the class times. So that the questions can be cleared up and just to ensure that you do your very best and get those things completed. So just as a reminder, remember community is bringing all your tools together. You've had fundamentals, you had med-surg, you've had peds. And so remember those people, those persons, they do not stay in the hospital, do not stay in those different places, but they come back home. So they come back to their community. So that's where we play a part in. So it's just not one set population, it's the entire population with whatever chronic disease, with the, the pregnant moms. So as you bring all your tools together for a community. Okay. We will look at week 1 notes. Let me pull those up for you. And I think I just sent you all an email. Let me just go forward and I'll go back to it at the end. I have narrowed down some information. Of course, your readings, you're supposed to read all the assigned readings, but for chapters 11 and 12, I just kind of went in and just made some notes for some things and make sure that you pay specific attention to in those chapters. And that's all that is that I sent in your email. And we'll pull that up and look at that as well. So let's look at week 1 notes. Week 1 notes, let me share my screen. Let's see here. So this isn't week 1 notes, but this is the calendar that I mentioned. Are you all seeing that? The exam? Okay, now it's
Yes, I
okay.
see it.
So here are the dates for the live exam reviews. So this is what I mean. Just go in and just see, plug in your calendar, dates and things that you're available. And you can attend any professors, it doesn't matter. Then our Zoom information is there. So all the way up, exam 1, 2, and 3, and then the history reviews. So, and this is inside of your course. Okay. Now week 1 notes. Okay, can you all see the?
Yes.
Okay. And these were shared too in the course room as part of the announcement with week 1 and then week 2. All right, so things, and I'll just hit the highlights as well. Of course, again, all your readings, make sure you do all your readings. But I'm just narrowing down those things that you need to specifically focus on. So community-oriented nursing, and you all feel free to jump in and add to the content. Community-based nursing, what is the difference? Both of them involves care, but which one focuses on wellness and which one focuses illness?
Oriented is wellness and based is illness.
Exactly. And so community-oriented nursing focus on like the whole population, while community-based nursing is specifically focusing on that individual that's ill. So you do have to know that. And then public health, it is sometimes, I don't want to say they're used interchangeably, but the focus for public health and community-oriented nursing are pretty much the same. That wellness care of that whole population. So be sure that you know the difference between community-oriented nursing, which is the focus is the whole population, and wellness care. And community-based nursing is illness care, caring for the ill, that specific individual, at any age group. And then we said public health nursing is looking at that whole population. Okay, the most effective method of preventing premature illness and death is through that health-related behavior modifications. And we'll talk more about that as we go down here and talk about the different levels of prevention. So the most effective method of preventing premature illnesses and death is through health-related behavior modifications. These are going to be your interventions, your care plans, your things that you will be implementing. So be thinking of those resources, the different other healthcare team members that could help with some of these resources. Okay, so now let's look at the different levels of the different levels of prevention, which are primary, secondary, and tertiary. And a side note, you do have to, for one of your attestation questions, one of them, you're having to list what these actually are. So primary is, the focus is on preventing an injury or illness, prevention. And so tertiary, I don't want to say they're kind of like, they are the opposite. But tertiary, you already have a disease process there. The disease process, the injury has already occurred. And so you can kind of think, okay, primary and tertiary, they're the direct reciprocal of each other. Primary, we are preventing an illness or injury. And then tertiary, an injury or illness has already occurred. And we're just trying to maintain it, prevent it from getting worse, or improve it. So for a broken bone, that a disease or injury has already occurred, so we're knowing that it's tertiary. And so we do want that person's bone to, mend, to get better, to heal. So for education takes part in all of the different levels of prevention. So don't just think that education is for primary, but education is needed for all three levels. So when there will be test questions on the different levels of prevention on every exam. And so you could be providing education to someone that has diabetes. So would that be tertiary or would that be primary? Based on what I've just said.
Tertiary.
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 Yes, great. Because a disease process is already there. It already exists, an injury or disease process, but you're educating them how to use the glucometer or to select different food items, in the grocery store. So the disease process is already there. But had we said that you have a group of people that are meeting at the community center and we are discussing healthy food choices and teaching them how to use the glucometer so that they can teach one of their family members that has diabetes, how to use it. Did you all follow me? Was that do I need to restate that? So the scenario is we are having a meeting at the community health center and we are inviting people or persons that have family members that have diabetes. We are teaching the people, not the family members that have diabetes, how to use a glucometer so that they can go back and provide support and also do some peer teaching, so to speak, with the family member. So is that primary or tertiary?
Primary.
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 Yes. So make sure that you read through the questions and specifically answer the question that's being asked. Diabetes was thrown in there, but the people that we were providing the education to did not have diabetes. And so, but just know education, it plays a part in all three levels of prevention. Primary, we're preventing a disease or injury altogether. Tertiary, there is a disease or an injury there. We're trying to improve the condition or maintain that quality of life. So now let's go back and talk about secondary. So secondary, we are doing what? What's the main focus of secondary?
Early detection. Screenings.
Screening, detection. So for secondary, we are like the Inspector Gadget. We're trying to detect to see if there is a disease process, see if there is an injury there. So an example would be, someone give me an example of a secondary scenario?
A mammogram, having a mammogram,
Okay.
even
Pap
though
smears.
yeah, pap smears.
Mhm.
Blood pressure scanning.
Okay.
Eye
Colonoscopy.
exams.
But yearly checkups.
Yeah.
What about a screening colonoscopy?
I can see
Yes.
that.
Mhm.
Yeah, lab work.
Great, good. So the levels of prevention are on all the exams. So be able to apply them to whatever disease process and in different settings. So that is on all of the exams. Let me just look back at my notes here to make sure. Okay. All right. So the next section talks about insurance, uninsured and underinsured. So first off, what is uninsured?
No insurance,
No insurance.
Mhm.
no health care coverage.
Okay. And so what about underinsured individuals? What does that mean?
Not enough insurance.
Okay. So just think about, and this is a way out example, but just think about here, we're going to the store and we're having this, I don't know, this community event. And we have said that we are going to prepare a meal for the participants. So we have our little list and we go up and down each aisle and we get to the register and they bring up all our items. And we have been given a budget. And so the budget says we spend $300. But in our budget, we have all the things that we need to, prepare the menu or to serve the meals that we're planning. So I don't know, was that a good example of being underinsured? You got, you had some money. Go ahead.
I had a patient today who came in for surgery,
Mhm.
and his insurance did not cover the surgery at all. So he kept asking, well, what percentage does the insurance cover? And it pretty much only covered just very basic annual exams, but didn't cover anything else. So would he be considered underinsured?
Exactly. So we're at the register and the cashier is saying, hey, I need $400, and we're swiping our card that's already been prepaid is swiping for $300. So yes, we had money, so we could get some of the things. Like you said, he could get the basic, maybe lab work done, but the actual surgery itself, it doesn't, it's not covered. So we're gonna have to take some items out of the buggy, and leave the others. So for that particular patient, he can move forward with the surgery, but he or she will have to pay for the surgery, maybe not right then, but they will receive a bill. So we can take all the items out of the store, but just know that we will have to pay for them. So yes. So, and just think about it, let's take it a step further. So we didn't have any other money in our pockets. So we planned this meal, we have all these things on the buggy, but our card only covered $300 worth of the things that we were supposed to buy to prepare the meal. So we leave out of the store and we go back to the community center and we start to prepare for this meal that we're having. Are we going to be able to serve the meal?
I mean, we can serve the meal. It won't be just enough for everybody.
That might be true, but what about we needed an ingredient that the main course, we didn't have all the ingredients to prepare the main course.
Yeah,
Yeah.
it won't be good.
Won't be good. So just think about it. Someone that has no insurance or underinsured, just think about the preventative screenings, going to the dentist every 6 months, going to get the annual pap smears done. Will these people be able to go get those things done?
No, not like every 6 months, maybe.
So what is the result of that? The bigger picture, they're not able to go get any of these things done because they're uninsured, or some of these things done. They had a pap smear done and it was identified as something was needed to be followed up on, and they needed more treatment, but it was not covered because the insurance just didn't cover that part. Just think about the larger picture. What is the impact of that on an individual?
And they'll be more prone to infection and illness.
It will be delayed that they won't get their health care.
Yeah.
They won't be able to get that treatment that they probably desperately need.
Take it a step further. What if that
And
person,
then they
go ahead.
And I was gonna say, like, they probably just won't follow up. Like, they'll just take the no, and then they just won't follow up with it.
It will make their health worse.
Decline.
Or they will come in with another illness along with that current illness that they have.
Because we do know that, certain illnesses can trigger other things. And just because, for example, things just continue to happen sometimes. But what if that person is also the breadwinner of the home? So we have a disease process going on. It's been identified and they can't get treated. So what other issues might occur?
Then they become unable to work, and so then they don't have any income coming in.
Also, like mentally.
So thinking about, we were talking about just physical. Great, you pulled in another part of the whole person. What about the mental aspect of that? You realizing, that person realizing, hey, I can no longer, or one day I might not be able to. So yes. So when go ahead.
No, I was gonna say, like, then, like, the stress probably will fall, like, it's like a domino effect. Like, the mom might be depressed, and then, like, she have to depend on, like, let's say she's the only adult in the household, she might have to depend on, like, her child or something to, like, step up and help her out. And that's really not the child's responsibility.
And so when we're out in the community and we are, we meet our patients, our participants, our, they call them, we call them different, have different names for them, but the person, you have to think like that, beyond what you're seeing right then, so that you can be proactive and start identifying resources, different resources that might be available and accessible. That's the other word that that is a biggie. Having that access, are these resources even available where these people actually live, or do they have to go to a neighboring town 2 or 3 towns away? So that is, that's a huge factor. And so the Affordable Care Act came into play, was it what was my notes say, 2018, 2019? But one of the purposes was to help offset the uninsured and underinsured. Sometimes like we were at the register trying to, we want to prepare the meal for the people that are coming to the community center, but we just can't because we don't have the funds. There's a sector called private insurance and then public insurance. And so the private insurance, sometimes, those things afford for someone to be able to have receive different services, is where publicly funded things might not have the same resources available, or tests, or surgeries paid for. So then this Affordable Care Act was try to level the playing field, so that a person, we all are human, would at least have an opportunity to, to receive the care or go out and get the care that they wanted for themselves or actually needed. And so, it did get some pushback because, you have these huge acts, and then, but there's like one piece, 2 pieces, it's all good. But then that small piece that says, people frown upon, because in the Affordable Care Act, if you didn't have insurance, people were penalized, but it was like a what they call it, impetus, emotion or something that was added in to encourage people to go get the health insurance so that they could go and receive the services they needed. So, but sometimes our best intentions are not taken as that. And so when people were penalized, you know, it was frowned upon. Any personal experiences or anything you want to share about, you know, in your work settings? And of course, don't call any names. We don't want to violate HIPAA or anything, but any interactions with the Affordable Care Act and people, your patients or anything, or you yourself being able to, you know, have that insurance and, you know, go get those resources and things that you needed. Anybody want to share anything? So be thinking about what kind of problems that uninsured or underinsured that they could create for your community member. And we talked it, we did, I think my example of going to the grocery store, I think it went okay. I think I may need to work on it a little bit. We may need to work on it a little bit. All right, so Healthy People 2030. So every decade, Healthy People sets these objectives and goals and things that, you know, they set for us, and it addresses all different areas. And the whole purpose is just so that we can live, everyone can live, you know, as healthy and as best of quality of life as possible. So it identifies, you know, brings to light, hey, we need to be focused on this, you know, and so, and as a result to that, it kind of tries to set like a domino effect. So bringing attention to an issue and then say, these are the things that we can do about it. So when our leadership, people, our politicians, when our healthcare providers and, you know, nurses and everyone that's on the healthcare team can be thinking about things that they can do to help meet that goal, in which the overarching goal is so that everyone can live, you know, their best life, best health now. So this right here, let me highlight this part right here. Healthy People 2030 sets data-driven national objectives to improve health and well-being over the next decade. So make sure you know that about Healthy People 2030. Okay. So now we're going to talk about the social determinants of health. What determines the health of individuals?
Like their lifestyle, where they work, their income, where they live.
You said the income, where they live.
Lifestyle, or like how they
Their educational abilities, their language barriers.
Good. So make sure that you know these 5 things. I think we addressed we didn't say assets, but I mentioned that earlier. So yes, the economic stability. You know, if we can't subscribe to the insurance, you know, because you know we can't pay for it, then you know it sets that domino effect off. So we can't, you know, so we will hold off on getting, you know, healthcare. So then when we are forced to go to the doctor, would you think the disease process would be in the early stages or the advanced stages? If someone does not have the funds, or
The advanced stages.
Mhm. Exactly. So yes, that is correct. More than likely it would be the advanced stages because they have not received those preventative measures. They have not done any of those to try to detect or screen for any of those disease processes because they just couldn't, you know. You would, you know, you weigh putting food on the table versus, you know, paying for a subscription that you may or may not use. So you like, no, we need to eat. So we'll worry about insurance later. So, and then education access, healthcare access, we talked about having to go to neighboring towns, because it just depends on your community. There might not be any specialist that your patient or that we might need to go to in our town. So we don't have access because we have to go 3 or 4 towns away. And that might mean me taking off a day of work. So I'm needing to put food on my table. I already haven't purchased insurance, so I'm gonna miss another day of work to go to 2 towns away just to see a specialist, that may or may not help. And so then that becomes a deterrent or a issue for me. So I pick going to work because I know that's, for sure. And that's not going to put me further behind, in my economic status. So our neighborhoods and our environments, which we'll talk about later on, when we get to talking about the lead paint, people being exposed to different things in their environment. And then your social and community. So make sure that you know those 5 domains. So social determinants of health also contribute to a wide range of health disparities and inequities. For example, people who don't have access to grocery stores with healthy foods are less likely to have good nutrition because it's just not there. It is not there. So if where they live, they don't have the grocery stores that have the healthy foods, they're unable to grow their own gardens, then, what do they do? How do they get the healthy food items? That raises their risk of health conditions like heart disease, diabetes, and obesity. And I don't want to say the overarching, but a larger picture or bigger pictures is it lowers life expectancy. Because if the people aren't able to, eat the healthy foods, which they might want to, but it's just not there available, then we know, even though how we love those cheeseburgers and pizzas, over time, it starts clogging up those arteries. And so, but if that's all that's available over time, the clogged arteries, our blood is not going to flow like it's supposed to. And then we have the heart disease, we have the strokes, the heart attacks, and it's just like it's a domino effect. And then as a result of it, we might not live as long as we would have had we had the healthy food choices available. So right here, just promoting healthy. Is someone trying to say something? Go ahead. No? Okay. So just promoting healthy choices won't eliminate these and other health disparities. Instead, public health organizations and their partners in sectors like education, transportation, and housing need to take action to improve the conditions in the environments that we live in. So I know our focus right now is becoming nurses, but then, your next step might be to run for an office. So, or create that nonprofit in your area. So be thinking about the different things, rules, laws that we could pass so that we can make these things accessible. So people can at least have the choice. It might not, they still might not make the healthy choices, which, we don't sometimes. I love those cheeseburgers and pieces too, but at least have it available. If I wanted to grow, some tomatoes, that it's available, or if I couldn't grow them, I could go down to the fruit and vegetable stand, at least purchase them. Any questions before we move on? Okay. Vulnerable populations. So let's talk for just a few minutes. Tell me, who would you think are vulnerable populations? Just name out some groups of people.
Chronically ill.
Elderly, homeless,
Disabled,
veterans,
inmates,
Good, good. Thank you for sharing. So generally, the children are generally referred to as a vulnerable population with respect to their health because their relative inability to advocate for their own interests and protect themselves from harm. So children are seen as the most vulnerable because they're not, they can't even speak up for themselves and to protect themselves from harm. So yes, all those are vulnerable populations that you all have named. So the chronically ill, people with chronic diseases, by definition, at risk for poor health comes. The reason they are grouped together as vulnerable populations is simply that sick people consume more healthcare dollars than well people. Recognizing this increased risk, Congress regularly mandates expenditures to pay for the needs of chronically ill, as they did with the passage of the 21st, let me move this off the screen, the 21st Century Cures Act. So a person that does not have a chronic illness compared to someone that does have a chronic illness, they are going to need more resources, more supplies, more doctor visits. So as a result of that, Congress, they regularly update and provide more coverage for those expenditures that are needed for the chronically ill. And that's another example, is what I was trying to allude to when I was saying, well, you become, a community advocate and starting that nonprofit or running for office, and you're creating bills and things that put things like this in play because you do have different experiences. If you are homeless, if you are a child, if you have a chronic illness. So you do want to kind of level the playing field. So someone mentioned language people that do not speak English or have a language barrier altogether, speak English but can't read. So that becomes a barrier because we're giving out all this nice literature, but if I can't read and understand what it's saying, what good is it doing? So you do have to know resilience. Right here, I'm going to highlight it for you. So know that the higher your resiliency equals less risk. So this is an instance where more is best. So the higher your resiliency, the less your risks are. So resilience is the ability to resist succumbing to health risks. So resiliency is influenced by early life experiences, negative events in childhood that aren't dealt with through counseling or other approaches can decrease resiliency. Do you all hear that echo, or is it just me hearing that echo? You all don't hear it, okay. Okay, so we do need to know this enfranchisement. It's feeling like they are on the outside of everyone else, forgotten, unimportant, or unseen. Okay, you need to know poverty is the primary cause of vulnerability, and it is a growing problem in the United States. You need to know that poverty is the primary cause of vulnerability. And so I think they're adjusting these also. Let me just turn my computer down a little bit. Maybe that's what it is. They are adjusting what they consider the definition or the guidelines for poverty. Federal poverty guidelines in 2016 was 24,300 for a family of 4. Just over the poverty guideline, and you don't qualify for certain kind of assistance. And so, you know, even if you're a few dollars over, then that means a whole bunch of assistance and resources that you don't qualify for. But then your income is just so that you can't afford those things that are needed. And so we should still work on those guidelines. They should be constantly revised. Because we do know that, you know, not having the available resources can lead to, you know, so many other things: crowded living, hazardous homes and jobs, less nutritious diet, and multiple other stressors. Okay. All right, and so I think that's it for week 1. So just as a reminder, all the readings, you are responsible for them, but I'm just going through, just trying to focus, key in on those specific things. Any questions before we move forward? I am going to toggle to the course, and we do know in the course, when it says Canvas readings, you actually click on those links that are there, and it takes you directly to the information. So let me look at module 1, and I'm going to share my screen in just a few minutes.
Do we have access to that PowerPoint or lecture that you just gave?
Yes, in the announcements, let me go to the announcements. Hold on, let me share the screen.
Okay, thank you, because I didn't see that earlier.
Okay, so on your announcements, every week, well, prior to that week, right at the beginning of the week, we send out an announcement. And it just tells you, hey, this is what's due this week. Look at these are your readings, these are the assignments. And usually in there, we will post or add, you know, something like that, a resource that narrows down what you need to focus on. So here it is right here. Can you all see the screen?
Yeah, I see it. Okay, I'll look for it. I just didn't see it when I was looking through it. So I thank you.
You're welcome. Those announcements are kind of busy, but just look for them. They're more than likely there will be some type of attachment to it. So here's week 2, and they're right here.
Thank you so much.
You're welcome. And so we're not sending the PowerPoints out because the PowerPoints consist of the entire chapter. But as you have seen, you know, for one chapter, there's only one page specifically they want you to look at, and it might be just a paragraph on that page. So sending out an entire PowerPoint for a chapter that you only need to look at a paragraph on one page, that would not be making good use of your time sifting through that whole PowerPoint. So we've created like these notes so that you can refer to them. Okay, so when it says Canvas reading, these are the links or the tabs that take you directly into those readings. And these are not located in your book. So these tabs take you directly to that reading. Okay, so Introduction to Community Nursing. So this article talks about the roles and responsibility. So and it talks about the different duties of the community health nurse. So as we mentioned earlier, we're performing screening tests, we're providing education for the most part about everything from A to Z. Because if you have, for example, a certain type of industry that's in that area, then, you know, it's specific to that industry. If you live in a college town, then your population is going to be mostly college students. So you are doing, your duties include providing screenings, education, from pretty much everything from A to Z. So if you have a college town, these are young adults. You know, they're the population that's mostly, you know, taking those risk behavior, higher risk behavior, having those higher risk behaviors. So think your education will be centered around things that have to do with that. But if your population is a town where there's an industry, for example, a car maker, then your education will be around maybe, you know, your education would be around getting more exercise, because for the most part, you know, they're at work most of the time. And so they're not out and about, you know, not, and this is not all or nothing, but I'm just, you know, just trying to just, you know, create a scenario that it might be this population maybe just be focused on going to work. So they might not be the ones that are out taking advantage of the walking trails and understand that physical activity is important. And so you as a community health nurse, you'll be coordinating, providing immunizations, which we know, you know, the pandemic occurred, and providing immunizations and doing that on the spot testing was a big thing. You know, they created makeshift clinics, ERs, all of that, right in parking lots. You know, and even still now, they have these pop-up immunization clinics where you just drive through. You don't get out of your car. The nurses come to the car. You open the door and they administer your injection, your vaccine right there. So roles and responsibilities of a community health nurse: you're the programmer, you're the planner, you're the health educator, you're the trainer, you're the organizer. You wear so many hats. And sometimes you wear several of those hats at the same time. You're the health monitor, you're the researcher. But for, you know, most of all, you're that advocate for that community. So how are community health nurses responding to the COVID-19 pandemic? We just talked about that. You know, for the most part, we're doing that testing, that rapid testing, the testing for the send-offs, the PCRs. We're administering those immunizations, those vaccines. And now they're even saying that the flu is on the rise, where some communities are having to like close their schools down, because if there's a certain percentage of the students that are, and students and faculty that display, you know, a certain type of symptoms that are alike, then they have to like shut down and do some extra cleaning and things like that. So they're saying they're urging everyone to go ahead and get their flu vaccines. And if you're not, you know, be, you know, proactive in covering your mouth, you know, when you're season, washing those hands and things like that, because they're seeing a uptake of flu. And then RSV for the babies, for the children. I think that was on the news yesterday. Okay, so let's go back. Levels of healthcare prevention. So let me hear from you all. Give me an example or scenario where tertiary prevention is being provided.
A patient who has cancer.
Okay. Secondary. So give me a scenario.
Screening for lung cancer. So the CTs annually, depending on if they have the nodules or not.
Okay. Okay. Let's do primary prevention. Someone give me a scenario.
A family member has cancer, so a person with a family member with non-cancer just goes get the screening just to make sure she doesn't have it, and to, if she does, to get in front of it.
So is that primary or secondary?
That would be secondary. You're right. I'm sorry. That would be, primary is preventing. So that's just your regular yearly checkups and things like that, right?
So primary is what you all?
Would it be
Prevention of the disease before it
Prevention.
occurs.
Like
Okay.
getting like shots, like a flu shot. and
Oh,
like
yeah,
that.
right. We can't hear you.
Okay, so primary prevention prevents the onset of a chronic disease by reducing risk factors for development.
Right.
Okay, so primary, we're trying to prevent. So what was the example again?
So going to your doctor, getting checkups, someone said get a flu shot, mammograms, things like that are primary.
So mammograms would be more of a secondary. But the flu shots, the pneumonia vaccines, any of the
Yes.
childhood, those are primary. Yes, dead on.
Okay, okay.
Mhm. And we'll talk more about those because it's some of them is just that little fine, that one little word, or depends on what you're what you're after. If you're trying to detect something or screen for something, then it turns into secondary, but it can kind of almost sound like primary. Okay. And that's that reading. Let's go back. And I think there are two more. Okay, we talked about that main objective. Make sure you know what that objective is for Healthy People 2030. The overarching goal, Healthy People 2030 sets data-driven national objectives to improve health and well-being over the next decade. So that's their focus. And take a look at their website. These are live links inside of the Canvas readings. Be sure to look at the Healthy People 2030 website. You'll be surprised as when I say they cover all different topics because, the whole idea is promotion of, our best health, preventing injuries and illnesses altogether. So they address everything. And so when you become those policy makers and run for those different offices and starting those nonprofits, that can be your foundation where you actually look at, evidence-based information to support why your cause is the cause that it is, because hey, this issue has been identified and these are the things that needs to be addressed. And we talked about vulnerability in those vulnerable populations. Let me see, I'm going to stop sharing for just a second. I'm not sure, I'm hearing something. Make sure you're on mute because I don't see anyone that's not on mute. I know it's not my background. So everyone, if you would just check to make sure you're on mute. Then we talked about those vulnerable populations. I think we discussed all of these different groups. And so these readings just kind of reinforce and it just layers it up so that you will have that understanding of it. Okay, so now we're going to week 2 notes. And remember, you are still responsible for it's all the readings that are there. But if it just gives you a page number in a chapter, that's all you need to focus on. That is all that is needed. I share my screen. And these notes will be attached in the announcement. So the announcements usually have them. So just looking out for the attachment each time. So school nurses, what do school nurses do? What roles do school nurses play? Anyone have any encounters with the school nurse?
Tube feedings if they are needed, asthma patients or students that need their inhalers, or if they're diabetics, they help them with their medication for lunch or after.
A lot of triaging, kind of figuring out what exactly is a tummy ache for one kid and a headache for another, and when to call someone a little higher or a parent to get involved.
Good, good. Yes, all that is correct. You're the direct caregiver, you're the health educator, even you're there for the students, but don't forget faculty and staff, they're there also. So if anything goes wrong, their toenail looks funny that morning, their nose is twitching, they are calling you before you can get out of your car. So you're there to serve and to serve the faculty and staff as well. Also, you coordinate for the faculty and staff the different health promotion things. For example, flu shots. They'll have flu shot drives, and they'll have people to sign up for wellness days. On those wellness days, they'll actually come in, and on those days, they just coordinate the people to come to a certain place so that they can get the wellness checks. And some wellness checks that they coordinate, depending on the resources that are accessible in the area, they do a lot. They do more than just the height, the weight, the blood pressure. They actually check cholesterols, hemoglobin A1Cs. And as a school nurse, you're the person that would reach out and try to coordinate those different things. Another example would be vision and screening. You may coordinate the people to actually come in and do the vision and screening for the different age groups that is recommended. There might even be a organization that provides glasses for individuals, the students that actually need them. So you would be that person that coordinate that, doing that community outreach. You're that case manager. Also, you would serve on the team. If a child has a chronic illness, you would be the person that would sit in on the team meetings. They call them individualized education plans, IEPs. So they have that health component. You're there to provide that education to the teachers, the other teachers, as well as that parent will be there, and you all will sit down and have that team meeting and decide on a care plan. An individualized education plan for a 504 for that student. There are so many hats that you will wear as that school nurse, and you will still provide those different levels of prevention. You might, exactly the example that you all gave, the diabetic student, the student that needs the tube feeding. And so there's so many things now, because the whole idea is to keep the children in school, keep them healthy and keep them in school. And so they're opening up resources and pretty much everything that you can do in a hospital setting for the most part. I mean, you're able to provide that in that school setting. You're doing Foley calves, you're doing straight calves in and out. On a student 1, 2, 3 times a day. They even have a program, I don't know if it's in all states, but a program where a lay person can do this educational, I don't know why, excuse me, I don't know why my phone is ringing, but I have it on just in case one of you all are actually calling, because I did have an instance where I was just talking away, and some kind of way I ended up on mute, and the students you all couldn't hear me. So thank God that my phone was up so I could hear it, because the student called and said, hey, we can't hear you. So anywho, I do apologize for that phone ringing. But going back to what I was saying, the school nurse, there's so much that school nurse actually does. Now there are in some settings, they actually have where a layperson can actually do some training, some special training. There's a test that they have to take, as well as some skills that they have to actually do. And they're called medications assistants. So they're able to provide care for students that have diabetes, They're actually able to give pill medications by mouth, and also some inhalers. You know, there's some limitations to it, but they're opening the roles so that healthcare can be provided where people are. That community is that school. So the child is of school age, and that's where they should be in our state, 180 days. And so let's provide the resources, put the people in place so that our children can come to school and be as healthy as they can be, and so they can learn and gather the tools and things that they need so they can grow up and be healthy, you know, individuals and live long, productive lives. And so we do know that other healthcare professionals come on campus. They, you know, the physical therapists, everybody comes on because they're coming to where the community is, which is the school, the students. So this gives different examples of each level of prevention in that setting. So know for family development, know these 5 functions of the family. Know those. Okay. And I have this table highlighted to remind me to tell you, don't worry about that table. Do not worry about that table. So family health risk. Disease develops in response to 3 contributing factors. You do need to know genetics, environment, and behavior. So this section you do need to know. So genetics, we are all born with certain predispositions, but the majority of the disease is not caused directly or solely by our genes. So most of them require a certain set of perfect and imperfect setting or environment in order for those things to, you know, come to manifest. So our environment includes the physical environment, the social environment, the political environment. Is it a high crime area? You know, is there, you know, is pollution? Is it an industry that puts off pollutants in the air? Is that part of the community? You know, is that why we're seeing, you know, so many people that have a certain disease process? Is it directly related to the industry that's there? So we have to consider the environment and behavior. We have to consider all of that. So know those family health risks. And then we're going to jump down to our common childhood ailments. So asthma. So you all tell me about asthma. What do you know about asthma?
It can be exercise induced, seasonal induced.
It narrows the airway and it makes it hard for somebody to breathe.
Mm-hmm. Okay. So is it linked to another one of the diseases that we have here? Is there
Eczema.
Yes. Yes. Okay. Good. So poorly treated asthma in childhood leads to no lung disease later in life. Is that true or false? So
That would be
go ahead.
Can you repeat that?
Poorly treated asthma in childhood does not lead to lung disease later in life.
false.
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 Okay. So, you know, that child that refuses to use the inhaler, or the mom, you know, the parent or whomever that doesn't provide that inhaler on the school campus, or whatever the situation is, you know, you might need to you know, say, hey, let's look at the bigger picture here. Let's identify some resources so that we can get the medications that's needed, so that you can provide the edge, because it might be that they just don't understand, well, hey, if we don't treat this now, once you get to be older, the irreversible damage is going to be done, and it's going to lead to a larger problem. So it could be just that knowledge, not understanding, but it could be the resource of getting that medication. And so you would have to identify, what that might be, because for the most of these disease processes, common childhood ailments, if they're not addressed right now, then it does lead to problems later on. Okay. And so they do have the different inhalers, the short acting ones, the long acting ones, and what else do I have here? A spacer is a common thing that's used too with children that have inhalers. Anyone know what a spacer is or could tell us about a spacer?
It's like a tube that you attach to the inhaler, and there's a mouthpiece that goes to the mouth, and it's to help allow the puff to actually penetrate the lungs even farther and get a good inhalation out of it,
That is correct.
which they use sometimes with adults as well.
Exactly, they do. And now I found out too that there's an issue sometimes with adults and their insurance paying for it. It's like, I don't know how this stuff is created, but these things are real. It's like, I don't know how much it costs, but I do know we've had some patients that the insurance didn't cover the spacer. And so the doctor had to actually, fill out all these forms to say why that the spacer was needed so that the insurance would go ahead and pay for it. But it's a spacer is commonly used more often in children, and it's supposed to improve the medication so it will reach deeper into the lungs so that it's more effective in keeping those airways nice and open. And then we do know people are using those filters too, those HEPA filters, just trying to keep those allergens and those out of the environment. And we did say that eczema was related to asthma. It is commonly associated with asthma. And people, you could have a family history. It could be genetic as well. So anything, what is eczema? Since I've went on to it, tell us about eczema. Someone. What do you know about it? So it is a chronic immune-driven inflammatory condition of the skin. It is associated with asthma. The immune reaction causes vasodilation and erythema with skin changes. So vesicles and crusting are common on the skin, scratching, and they're most commonly areas of the face and in the skin folds. The immune reaction to orally consumed foods, inhaled allergens or pollutants, topical exposures like soaps and fabrics, too much sun, those are things that might aggravate it. And they might do allergy testing to identify those known triggers so that they can stay away from those known triggers. So tell me about diabetes type 1. What do you know about diabetes type 1?
They don't produce enough insulin. They don't produce insulin, so they're insulin dependent.
And you're gonna only take metformin for that, like diabetes 2, you can't take metformin, but you can from diabetes 1. I think that's just vice versa.
Yeah, it's a genetic diabetes one.
Is it most common in children?
Why would we say it's most common in children?
Because they usually catch it earlier, like because your body doesn't produce the insulin at all, so it's caught earlier.
You all are rocking. Great. Anyone else want to share anything else about it? Treatment is insulin replacement and teaching to control that glucose through insulin diet and exercise coordination. And so with the children, you have to be careful because, they're growing, so they'll hit those growth spurts, and then sometimes those pancreas will be on honeymoons, and those sugars, those blood glucoses will be all over the place. And so those, great, you all did well with that, pulling up those important points. What about this conjunctivitis? What do you know about that?
Pink eye.
Is it contagious?
Very.
Very.
Okay. Alright. So you're gonna be teaching things like those hand washing, avoiding touching the healthy eye because it can spread to the other eye, and taking the antibiotics, the eye drops as needed. I mean, not as needed, as prescribed. And usually they're able to return to school because they actually go home for that because it's, you know, contagious. They're usually able to return to school 24 hours after the antibiotic has been started. What do we know about scabies?
Girls.
They're bugs that burrow in the skin.
Mm-hmm. How do we,
And they're,
go ahead.
I'm sorry, I just added that they were itching, like it makes you itch.
Mm-hmm.
And it's almost like a reddish that your skin gets, and you can kind of feel a little bit of bumps and so forth.
Yes, it's like she said, the little it just burrows in just under your skin. You're right. And so they do have the topical cream that you put on, and then you have to, from head to toe, essentially. I don't think you put it on your face. And then you wash it off and put it back on. You have to reapply several times. And you want to, for the clothing and bedding, you want to dry those at a high heat. Wash and, you know, and dry them at a high heat. And then those non-washable things, you want to bag them up for at least a week, because after a couple of days, those mites, they actually die off. Okay, what about head lice? What do we know about head lice?
Very contagious.
Getting
Does
rid
it
of them is
mean-
similar to having scabies.
Doesn't mean that you have to be unclean. It can be from someone being around or using somebody else's towel.
Sharing
like
phones and hats
comb.
and things, and you know how, you know, the children do. They love to share. They're just giving and free, you know. So they, you know, they start the day off with, okay, what are we exchanging today? That's just something, most of them, that's just their little routine. By the end of the day, they have on a different shirt, shoe, backpack, everything. This is what they do. This is how they share the love. Yes. And as a result of that, sometimes, you know, problems arise. So ADHD, what do we know about that?
Hyperactive children. Their brain is moving faster than their mouth can say, and can't focus on one thing at a time. They usually are very smart people.
That's a hard one. It seems like everybody want to diagnose their kid with ADHD, when usually they can just be bored and say, oh, well, they have a short attention span, so they want to medicate them or make them zombies.
It sometimes is treated with medication or some type of therapy as well.
So you as that school nurse sitting down on that IEP team could, you know, these are some recommendations, you know, that you could, you know, present to the team. Hey, we just need to provide rest breaks after 30 minutes. Hey, you know, let them stop and do something and come back. You're right. They may need tutoring. You know, it, like she said, it might not even be ADHD. It might just be that your child need to be tested and see if they're gifted. They might need their work presented in a different way. They may need to be challenged in a different way. So yes. Iron deficiency anemia. What do we know about that?
Low iron.
Low iron. Does it, can that have an effect on the child's growth and cognitive development?
Yes.
Yes.
Okay. And why is vitamin C important if someone's taking iron?
It helps
Because they
absorb
import
the iron.
vitamin C.
Vitamin C improves the absorption of the iron, yes. So scoliosis, what do you all remember about that in going to secondary school? You all were screened for
Checked by the
scoliosis?
nurse.
Go ahead.
Getting checked by the nurse.
Mm-hmm. So tell us about what are they looking for? What happened?
S shape or C shape curvature of the spine when they bend over to try to reach their toes.
Mm-hmm. Yeah. So you all might be, it depends on what setting you end up in, you might be doing the scoliosis screenings. Usually the school nurse and the physical education teacher, they kind of partner up because, you know, usually the students are changing clothes for physical ed, PE anyways. And so it's just a quick, you know, have the child bend over and they look at the spine, look at the arms and see, you know, they hanging, you know, this equal or unequal. So lead exposure, what do we know about that?
It can be caused by paint, soil, just basically your environment
Okay.
and toys.
Okay. And it is not seen as much. So back in the day, it was like an automatic. They drew lead levels on all children, but so now they've kind of got a handle on it. So what now the nurses do, they do like a questionnaire, and depends on the answers to the questionnaires, then they'll move on into, you know, actually doing the blood testing for the lead levels. Okay, so now we're going to switch gears. Everyone log into your course and let's look at this quiz. Let's work on this quiz together. Let me stop sharing and get in the course. Quiz number 1. Quiz number 1. And I am going to share my screen here. And of course, feel free to answer your quiz as we go along. We'll talk about it and finalize what our answers should be. Okay. Question number 1, which is an example of community-based nursing practice?
My computer's messing up. I minimized it, but
Okay, I would just jot it down on a piece of paper. So are you all able to see the questions and the answer choices?
Yes.
Yes. So
Yes.
even if you're unable to log into the course right now, I would take my notes. So number 1, which is an example of community-based nursing practice? So talk to me. What are you thinking?
Developing a teen pregnancy prevention program. That would be part of it.
So go back to community-based and community-oriented.
Evaluating the outcomes of the community vaccine program.
Community-based is focused on
Everything, right? And everyone.
Ain't this focused on a certain population?
certain individual.
Oh, well, educating
whole.
a child and school teacher on how to use an inhaler.
That is correct. Correct answer is B, educating a child and a school teacher on the use of an inhaler. So remember, for the content, we have to be able to apply it to, we have to know the definition of it and be able to apply it to a situation. So yes, remember, community oriented is the whole population, but community based is that individual. So number 1, we would say is B, educating a child and school teacher on the use of an inhaler. Okay, number 2, let's look at which describes the purpose of Healthy People 2030 campaign.
Is it A?
A.
Guidelines for treating the most common chronic disease.
So we have A and B.
I'm gonna say A also.
I say it changes the focus from community health to individual. No.
No, I think it's because the point of it is to improve the health and well-being over the next decade.
Okay.
Of who? Is it just
Of
people with chronic
Americans.
diseases?
Everybody. It should
Everyone.
be everybody
Everyone.
across the states.
So it's A.
It is A.
It's
It's
A.
everyone. It's everyone. Yeah.
But everybody's not American.
That's right. But Healthy People 2030 are for, it's for us, for the Americans, just me.
Okay.
So it is A.
Is that? It is A. Okay, let's look at number 3. What do we have?
I'm going to say C.
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 I think the C's have it. I didn't hear any other letter, and I would agree. They're more likely to be diagnosed with advanced disease. You know, we talked about that because, hey, you know, they're not going to get those regular screenings, you know, the 6-month world checkups, the, you know, just going in, getting those regular routine exams, pap smears, just baby checks and things like that. Okay. Number 4, what do we have?
B,
C and D.
B, C, and D.
Yes.
Yep.
Do we agree or disagree?
Agree.
I agree.
Agree.
I agree. So why wouldn't the 26-year-old pregnant woman be a vulnerable population?
I was just gonna ask that.
Because she's not a minor.
Yeah.
She's healthy and pregnant. That's
Yes.
normal.
There's no disease process going on. They're they're considered healthy. They're within an age range where, you know, pregnancy is not uncommon. And so they haven't been exposed to anything that's not considered, I don't want to say normal, you know, because we don't like to use that word, but, you know, so yes. So B, C, and D. Okay, number 5.
I'm going to say A.
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 Okay, I agree. Resiliency reduces our vulnerability to certain risks. Because remember, we said the higher your resilience, that risk decrease. So they're like the opposite. So you want a high resiliency so that we have a decreased risk or lesser risk. Okay. Number 6.
A.
B.
Only said A because I feel like it might be like allergic reaction.
I would say B.
It's B because of airway.
The ABCs.
Because of the airway.
Yeah.
Yeah,
You all
it's
are
B.
rocking, always airway.
Yeah.
So what part of B tells you is airway?
Cough.
The cough.
Yes,
And unable to be.
Unable to participate.
Physical activity.
exactly. And then the piece about not only just as a cough, but they can't participate in PE. It's like something's going on. So they're not able to participate because they can't breathe. You know, they having trouble, something going on with that respiratory. And you all are correct. Always airway. All right, let's look at number 7.
Eggs.
A.
And eggs provide us with what? Begins with a P.
Protein.
Protein.
Beautiful. Rocking, I agree. Number 8.
B.
B.
And someone explain why are you saying B?
Because it could be pre-diabetes or something like that.
Why would you say that?
The crease going across the back of the neck.
The dark
The
discoloration.
dark discoloration. Yeah.
So that is a known symptom or sign of
Diabetes.
So yes, great. So you would advise them when we don't know, it may or may not be, but you know, evidence-based information does say that it could be. So yeah, it's worth working up. Full evaluation. Okay, question number 9.
A.
Yeah.
Yeah, it's A.
A.
Someone explain it. How did you come up with that?
The lead exposure.
Lead toxicity is developmental delay is a symptom of lead exposure.
Yeah.
High level
It affects your development.
in children.
Yes. Spot on. And then number 10.
C.
What's wrong with screen time?
They
They
just
gonna
sit
sit
and
there
eat.
and eat.
They're just
Sit and
sitting
eat.
and eating.
No activity.
They ain't moving around.
Get up and move. Yeah,
Right.
I agree. I agree. So if you were not able to plug them in, hopefully you wrote those down. And so you can go ahead and actually submit it if you were able to plug them in. And we'll give you a few more minutes toward the end to go back and plug those in so you can get that done. That'd be done and over with. So I'm just going to show you one more thing and then we're going to go, well, two more things. Let's look at what I actually sent to your email. So for chapters 11, are you all able to see my screen? No.
It's still on the quiz.
Okay, let me
No, we're
stop.
still on the quiz.
Okay, let me stop and reshare then. So I sent this to your email. So for chapters 11 and 12, just went in and just kind of narrowed down. Of course, you are responsible for all of your reading assignments, but I went in to try to narrow down. So your focus for exam, this is narrowed down, the content. So for chapter 11, just look at all of the objectives and just make sure that you can discuss and that you understand, you know, what those objectives are talking about. And then throughout the chapter, because 11 and 12, your reading assignment says the entire chapter.
Jameson, come see you because he's not been moving around. He's been grouchy.
Catherine, oh, let me put
Sorry.
It sounds like, what? Okay, and so for chapter 11, I went ahead and narrowed down the content. Of course, you're responsible for all the reading, but for test purposes, I've narrowed down the information. So just take your time and just go through this list. And I sent it to your email. And then for chapter 12, just look at the objectives 1, 4, 5, and 6. And then these topics here. So that's what I sent to your email. Okay, so what we're going to do now is, if you're in the course, let's go ahead and look at the attestation. Let's go ahead and complete that. You have 4 questions, even though there are only 3 points, but they have it where there are 4 questions. So questions 1 and 2, I think, are just alike. So log into the course. 1 and 4 are just alike. So go ahead and put today's date and my name. You can just do Professor Morton Ford or Professor Ford. It's fine, either one. For questions 1 and 4, today is October 14th, 2022. So what are we doing? We're doing the attestation. We're going ahead and completing that. Questions 1 and 4 are the same. So put today's date, October 14th, 2022, and then my name. And then for question number 2, it wants you to define primary, secondary, and tertiary. So you can type primary. What is the main focus of primary? Begins with the P.
Preventing.
Prevention.
Okay. Primary prevention. Secondary, what is the main focus of secondary?
Screening.
Secondary screening.
Screening.
Yes. So type secondary, then screening. And if you're unable to get in the course room, just go ahead and jot this down. And then for tertiary, what's the main focus? Say that again. Treatment. Yes, treatment. Okay, so now let's look at question number 3. So you're supposed to give an example. So refer back to your week 1 notes, and I'm going to actually share my screen. And so you can just kind of get an idea. you're giving examples. So I'll just be quiet here and let you type up primary, secondary, and tertiary.
How many examples is it asking?
Just
I'm
one,
writing.
one for each.
And then is this still for question 2 or is this for question 3 now?
This is question 3. Question 3.
Thank you. It's not letting me do the Zoom and online for some reason. My computer is messing up.
Okay, that's fine. That's fine. But just make sure you jot it down. So once we'll give you a few minutes here at the end to either, log off and go ahead and do that. So you have time within this time frame and it is done and over with.
Thank you.
You're welcome. So would someone like to share what they wrote for primary?
Immunizations. I just put
I
immunizations.
said giving a sex education class for primary.
I said
I
putting
put
on a helmet while
vaccination.
riding a bike.
Okay. Would someone like to share their example for secondary?
I put mammogram.
Lung screening for lung cancer.
Tertiary, would someone share what they have for that?
I put managing disease by taking medication.
I put managing diabetes.
Okay.
Weight
so
loss for type
go ahead.
2.
What'd you say?
The weight loss for type 2 diabetes.
Okay. So I'm going to mute myself so I won't keep interrupting. So give you a chance. So what are we working on? We're working on the attestation, the 4 questions. The questions 1 and 4, you should have today's date, October 14th, 2022, and my name for both questions. Yes, they are both asking the exact same thing. Question number 2, you all told me that primary focus is prevention. Secondary focus is screening. And tertiary is treatment. And now we're working on question number 3, which you're giving an example for each level. And so I will mute and give you all 2 or 3 more minutes to type that up and to submit it.
My computer may go dead, but I've completed the attestation.
Did you complete the quiz?
I did, yes.
Okay. Getting just a few more minutes, give everybody time. And for those of you that have to log off, just hold on one more second a couple more minutes before you log off.
put all the answers in that we gave, and they gave me a 9 out of 10.
Okay, so I'll go back and look at that. Which one we need, and I'll send an email if we got, did you put in did it say which number?
No, it has the answers, like after you submit it, it don't let you see the test.
Okay, so let me see if I can find out which one, and then what you'll do is send a email saying which one. Let's see. And what was your name?
Patrice Hill.
Miss Hill. Let's look and see if I can see it.
Miss Morton,
Yeah.
my quiz gave me a 9 out of 10 too.
I got a 10 out of 10.
Let's see what we can find out. I guess. Wait. Okay, so are you all able to hear me?
Yes.
Okay, so for those of you that
Yes.
did not get a 10 out of 10, which there are a few of you all, I need you to, and it's, it's up to you. You can either keep the score that you have or resubmit the answers on a Word document or in an email to me.
Okay.
Okay.
Yeah, so somewhere along the line, either you didn't catch the correct answers or you didn't click the correct answer. Most of you all have 10 out of 10. So, and put in the subject, quiz 1, and just resubmit all the answers, and then I'll check them again. And then hopefully you'll have a 10 out of 10. And I'll go ahead and change your score. Because I can't reopen it back up.
Okay, thank you.
So it's showing you what you've made. So if you made less than 10, send an email resubmitting 1 through 10. Submit all the answer choices again. So either, you selected the wrong thing or you didn't catch what we were saying the correct answer was. Because I can't open it back up and, so that you can resubmit it that way. But we can, for this, for the quiz, take an email with you, writing all the answers down again and resubmitting them. Okay. All right. So let me share this other thing I wanted to bring to your attention here. So you do have this assignment that's due in week 9. This HESI prep assignment. And it is, how many pages? It's 5 pages without your content in it. And so, it's really more than 9 pages. It's a, a huge assignment, it is doable. And so our plan is, as we cover those things, to allow you time to talk about it in class and go ahead and fill in your information. And so it layers things. So you're repeating it. You're getting the content, you're listening to your coworkers, your fellow students, and we're talking, you hear me talking about it. And then, so when you come to the exam, you're good because we've went over it several times and the information is there. So you do not want to wait until week 9 or 8 to even week 7 to start working on this. So I would advise you to go ahead and print this out or at least have it on your desktop where you can fill this in, because we'll do a group discussion either in groups or, a whole group or small groups, and you all working on this, weekly, as we can, so that you all can start filling this in and start prepping now for the end. So make sure you have this document either printed out, where you can jot your information down, or just save it on your desktop if you can. Send it to yourself in an email so that it's there. And so that you can just add to it as we go along. Okay, any other questions or concerns about anything? We talked about the quiz. If you did not get a 10, something was not entered correctly. And we can stay on if we need to for those that have, have questions about that or need assistance with that. Look at your email at those points that I've narrowed down for chapter 11 and 12. You should have completed your attestation. I know some of you all can't because you're on Zoom. You can't do both at the same time. So once you log off, make sure you go ahead and do that because class officially ends at 9 or 10 for you all, not for me. But use the rest of those minutes, then it's done and out of the way. You don't even have to worry about that. You're just waiting on week 3 announcements and look at your calendar and post. Go ahead and select some of those live review dates. Just go ahead and plug it in on your calendar so we can be proactive. Study guide should be coming out by Sunday, no later than Monday. We can start prepping for that. Any questions or concerns about anything? Okay, so we will allow this time for those that need to log off to actually complete the assignments to go ahead and get that done. And for those of you that need one-on-one or have questions or concerns about something, I'm still here. So 9 o'clock, for those of you that have logged off, class ends at 10. I'm sorry, 10 for you all. So do something until 10. It's an honor system. Make good use of this time that you set aside for, this time. All right. So have a great weekend. Thank you all for sharing and taking part in our journey tonight. We'll see you next week. Oh, and then they did tell me one more thing. I'm sorry. I keep saying one more thing. The answer was they don't believe we do for the Friday after Thanksgiving. So really not sure, but they don't think we do have classes. Okay. All right. Good night. Have a great weekend. And I'm here
Thank
till
you.
9.
You too.
Log off.
Good night.
Good night.
Have a nice weekend.
Thank you. I'm here till 9. So those that need to hang around.
I do have a question. I have a schedule conflict for 2 Fridays. I have 2 family weddings back to back on a Friday night. Is there another lecture that I can attend during the week to still be able to get that credit?
And as far as I know, let me look. I know there are other classes. There are 3 of us, but I think the other ones are on Fridays, but there's one on another day. Let me look and see if I can see what day that other class is on. I know one is on a Friday from 1 to 3. And let's see. I can see the time of the other one. That's Friday 1 to 3. Let's see what time this one is. Trying to see what time this class is. So if you would, are you able to go to your email?
Yes.
The email that's not in the course, but the email that is the Outlook email?
Yes.
Okay, so if you would right now access that email, start an email, send it to myself, which is, what is my email? Shelicia.mortonford. See if my name pops up.
Okay.
It's Shelicia.
Yeah, it's just taking its sweet time loading.
Okay, that's fine. Let me know when it pops up. And the other professor name that you need to place there is Professor Marvel, and her name, first name is, it should be Kathleen Marvel